Good morning, good morning, good morning, or good afternoon for those of you who are on the East Coast. My name is Dr. Romina, and every week I come to you and I offer a community, as a community service, I offer my knowledge, my experience, and my education in order to help you have a better life. My goal is to add something more valuable to you. And today we're going to talk about musculoskeletal conditions. So let's get to the first page and start this presentation. So every week I come to you in order to help you find ways to enhance your life. These are the same advices that I offer to my patients. I've been in practice since 1995. And as a clinician, I've noticed that too many cases could have been prevented before they have come to my office. I am the founder of Think Healthy. My clinic is in Los Angeles, California. So if you're around here, join me and come over. Love to see you, love to meet you, or follow me on Instagram at Dr. Romina _. So here we go. Let's learn about those musculoskeletal conditions. So what exactly is musculoskeletal? Well, we can break the word down to muscle, right? We know that. And we can break it down to skeletal. We know that too. So the musculoskeletal system is really the foundation of your mobility. It's the ability to move and is in a fluid, without pain, without limitation, to the full range of motion, where your muscles, tendons, and ligaments, and joints, and the cartilages, and the fascia and the connective tissue, all of these are like the symphony of an orchestra. They play the beautiful melody of moving without any restrictions. If you do have restrictions with your movement, your musculoskeletal system is not harmoniously working together. Pardon me. So I want you to just palpate or touch the muscles of your arm. And now touch the muscles of your leg. Now go ahead and touch the deeper muscles in between your pectoral and your shoulder, right under that shoulder groove, right? Go ahead and feel those. Are they a little bit more tender compared to the muscles of your arm or your legs? What about the base of your neck or the muscles in between your shoulder blades? Do they, when you touch them and you feel them, do you think that might be a little bit more tighter than the muscles of your arm or your legs? If you do feel that, there's obviously not a harmonious or a balance or homeostasis in your musculoskeletal system. So let's find out what could be going on. There's another factor we have to consider. You see, muscles, tendons, ligaments, their function, when they're stimulated by the nervous system, their function is to move the bones. And because these bones sit on top of each other, they create what's called a joint. And there are areas where there are two or more bone meets in order to create a joint. Let's say your knee joint consists of three parts, which is your patella, your tibia, your femur. And then you have your shoulder joint, that's more like a ball and socket joint. Then you have your hip joint, which is more of a deeper ball and socket joint. Then you have the joints in between your neck vertebrae, which have a whole different configuration than the joints in the middle of your back, which totally are different than the configuration of how they're sitting on top of each other of the joints in your lower back. You see, the dominant motion of lower back is flexion extension. That's the dominant motion. The dominant motion of the thoracic spine is rotation. So you could fluidly move to the side to side. That's why most people with low back pain have a harder time bending forward, backward, going sideways maybe, but they rarely complain of mid-back pain, because if it's a rotation problem, it's really a mid-back problem, not a lower back condition. Your neck muscle joint configuration is more of a rotation and lateral flexion. So you definitely have a combined movement of all those. Different joint positions offer different mobility. Your arm offers a 360-degree movement from circling your arm around, whereas your hip doesn't offer that full of a mobility. Maybe it offers a flexion, extension, abduction, adduction, going outwards, going inwards, help you to get in the car, out of the car, in the bed, out of the bed. So these joints are very important, and their configuration are extremely important in how they communicate with the musculoskeletal system. So what happens when all of these are not in harmonious, proper functionality? What happens? You see, your whole health is a combination of chemical, physical, and mental balance. Today, we're going to talk about the physical balance, but sometimes your physical balance can be affected by by chemical imbalances in the body, such as calcium, vitamin D, or vitamin B, right? Let's go ahead and dive into that a little bit more. Muscle diseases, not just the fact that you can't move or you have aches or pain, but serious conditions of muscles can be seen by muscle atrophy. So you can see how one side is more thinner than the other. That's a normal muscle group, and this is a muscle atrophy. Could be caused by different causes. One of the indications is that it's definitely weaker, thinner, more flaccid, typically seen in conditions called myasthenia gravis. Then you have other condition. Pain is present when the muscle disease is caused by a blood circulation or an injury or inflammation of the muscle. So let's say you fall and you hurt yourself, and now you have swelling and inflammation because blood circulation is going there to heal the injured tissue. That's when you treat the area with ice pack. Do not heat an area that's inflamed. Do not heat an area that's been injured, especially in the first 24 hours. You will make the condition, maybe you feel better, but it's just a feeling. It's a feel-good sensation. You're causing more damage and increasing swelling and inflammation. So bear the pain and handle the ice. So please make sure inflammation, you ice it 15 minutes to maximum 18, and you do it 3 to 4 times. But then there are areas that you have chronic problem, right? Where there's more of a fatigue, and that could be associated with muscular dystrophy. It's a hereditary disease, it's a congenital problem, and cramps could be another function. Either it's a motor sensory irritations, or maybe it's a chemical disorder such as hypoglycemia that could cause that. Those leg cramps could be definitely related to your diet. But let's find out more other conditions. Sometimes instead of muscle thinning, they actually become hypertrophy. They're not hypo, now, which is less, they're hyper. And trophy means the shape, like metamorphic or metatropic, right? Muscular hypertrophy is the enlargement of a muscle in an abnormal motion. It typically happens in athletes that are exercising in a certain area, but it also can be shown in muscular dystrophy. We call it myotonia congenita. So this can be a combined series of symptoms, but definitely there is something going on. And you see the pseudo hypertrophy of the muscle that does not match the thighs. That means that this is not exercise induced. This is definitely something else. And muscle enlargement due to deposition of fat rather than muscle fiber. So the area can be a little more flaccid when you touch it, when you palpate it. Typically, we see that with cases of Duchenne type of syndrome. There's other factors. There could be tetany, when there's sudden cramping and spasm and involuntary contractions of the muscles in your arms and in your legs particularly. Sometimes you might feel it in your larynx or voice box, but it results from the lower levels of calcium in the blood or from alkalosis. So check the alkalinity of the blood. It's important. Lockjaw, when it occurs on regular basis, could be caused by that, and it's really caused by toxins produced by a bacillus called Clostridium tetani. So what are these signs and symptoms? What are things you should look for? Look for weakness, look for shape, look for changes in the positioning. Compare right and left side of your body, compare front and back of your body. Indications and symptoms and signs like that are going to tell you that if you're having developing a muscle problem. Weakness usually is the underlying cause of most of the problems. But the pattern of the weakness is an indication of what type of muscle disease you have, which you could definitely contact us through telemedicine, contact your primary physician, and get that checked. Earlier, the better. And it costs you less time and money. There are different classifications of muscle weakness since we are on that topic. You have to see how much the muscle contracts, and it results from a chain of events that begin with a nerve impulse. You see, your muscles have no ability to contract themselves unless they're like involuntary muscle groups, such as the muscles of your digestive tract, the muscles of your heart. But even the muscles of your digestive tract are controlled by the nerve stimulations. So your nervous system controls the actual function of your muscle, which ultimately pulls on the bones, moves the joint, and a motion occurs. Whether this is a nerve impulses to your peristaltic motion of your digestive tract, where the food mechanically changes the tensions around the muscles of the intestine, and that causes a reception activation to the nervous system, and where the peristaltic motions occur, or where there is nerve impulses to the muscle that contracts the muscle spindles that send signals through the brain, and muscle contraction occurs. So these are more of a cerebral cortex in the brain and the spinal cord function. On a side note, since we're on the topic of the motor neurons, your cerebellum, which is at the base of your hairline, at the base of your skull around your hairline, is responsible for the function and coordination of your muscle movement during a walking action, typically developed during your crawling phase as an infant. So crawling and crisscross exercises are very helpful for cerebellum function and health. There are other conditions. There are like upper motor neuron lesions when there's actually a spinal cord injury, right? Multiple sclerosis is an upper motor neuron lesion where you actually lose the function of a limb or a side of a body. A stroke is like that. Then you have lower motor neuron lesions. These are usually by degeneration to the neurons or the nerves, and they create more of a flaccid paralysis rather than a spastic. And they cause muscle wasting and eventually lead to denervation or lack of function. And typically seen with Lou Gehrig's disease, also known as amyotrophic sclerosis. Typically, symptoms occur around the age of 50 to 70. There's another condition called peripheral nerves. You may have experienced it as a restless leg syndrome, or maybe numbness and tingling in the hands, carpal tunnel syndromes. Typically happens after a trauma. Last week we talked about motor vehicle accidents. It's very typical to see lower motor neuron lesions or peripheral nerve lesions with motor vehicle accidents. So you might want to definitely check that webinar that we had last week. But what is the number one indication of a muscle problem? You see, musculoskeletal conditions, not the disease part, but the actual shifting of the muscles from a normal function, which is the predominant effect of musculoskeletal conditions in our society right now. Let's move away from the 20-30% disease conditions and focus on the general, the predominant musculoskeletal conditions that you and I suffer on a daily basis, such as poor posture, poor sitting habits, poor ergonomics, poor sleep habits. Look at your posture, or maybe you see a loved one that has poor posture. Our Gen Z, unfortunately, are at a dramatic danger with the technology side effects. Now, please consider the fact that I am not against technology. We are communicating through technology. I love and appreciate, and I'm extremely grateful for technology. But everything does have a side effect, right? You're not going to stop eating because you're afraid of getting cavities, you have your dental toolkit, then don't be worried about using technology. There is a solution for it, and that's what we're going to go into right now. So let's move from disease and talk about musculoskeletal conditions and symptoms, right? Poor posture would actually rob you away from your energy, your productivity, your endurance, and living a good, high quality life. And unfortunately, it sets you up to suffer from degenerative joint disease, also known as arthritis. You see, musculoskeletal conditions are 50% dominant in affecting health conditions in the United States. And this is from National Health Institute. This is a serious condition, and it does not discriminate by age, sex, body type, gender, color, religion, none of that. If you have a spine, if you have a technology, you're going to be at risk. So let's talk about it more in detail. Every year, we're usually spending millions of dollars on addressing health conditions. The most amount is spent on musculoskeletal condition. Do you know why? Because it is predominantly causing problem at the work area. So an average person complains or loses time from work because of musculoskeletal conditions higher than anything else. Sorry for the poor graphics over here. But if you just look at the bar, you see the musculoskeletal conditions are 24.5% higher than any other condition. Let's say circulatory, vascular, trauma, tumors, diabetes. Diabetes is only 1.6%. Tumors and cancers are 0.5%, whereas musculoskeletal conditions are 24.5%. This is a significant number that needs to be addressed. So don't take your neck pain, upper back pain, shoulder pain, arm pain, hip pain, don't take them lightly, because they are serious conditions that need to be addressed. They're chronic, they're low level, but they're very common that need to be addressed on an immediate basis. One of the number one factors that causes musculoskeletal conditions that affect your work and your home life and are repetitive stress injuries. This could be whether you're a dentist working on a patient or work in a dental field. This is if you are working as a cashier at a supermarket. This is if you're a mom and you're constantly bending, twisting, turning, lifting, pulling, pushing. You're almost as bad as working in a construction company. This is for our healthcare practitioners. Healthcare practitioners are 50% higher at risk right now at the work and ergonomic and health and safety arena that we are concerned about. Healthcare workers have 50% higher rate of injury to their musculoskeletal system than a construction worker, than a person that works in warehousing. We need to take care of our healthcare practitioners more so than ever on today's, because they're under definitely a lot of emotional trauma, psychological overload and fatigue because of the work that they're offering and saving people right now in this COVID era, plus the fact that their body is exhausted with overuse and repetitive injuries. So if you're on any kind of health, like manufacturing or assembly line or administrative, or if you're a corporate athlete or you're an industrial administrative athlete, I call them, because you work about 6 to 8 hours a day or maybe more, then please pay attention to your symptoms. This is also repetitive stress injury. And which one of these do you find yourself when you're lost in your work? I know some of you have skipped lunch or dinner because you were working. And I also know some of you have skipped going to the bathroom just because you had to get that last thing done, right? So we've all been victims of that. When you get involved with what you love, it's very easy to lose track of time. But let's take care of you. One more statistics before we go into solutions. Another statistic is the fact that your head weighs about 8 to 15 pounds. Normal posture is when your body is in full alignment with your posture, which means that your phone is really at your eye level. This is the wrong picture, right? But this is showing you when you pick up your phone, when you pick up your smart device and it's in front of you, as soon as you drop your head down by about 1 inch, which is about 15 degrees, you just overloaded your upper back by 27 pounds. Then you add another inch. Now you really are interested in what's going on Instagram. So you dive in, and now a few hours have passed by, and this is the amount of load that you're putting on your body. And mind you, you take this number, multiply it by 3, that's how much you're loading your lower back. And that's for those people who look like a comma rather than exclamation mark. And interestingly enough, today, I took a screenshot of this yesterday. Over 18 million texts are being sent every minute. So don't think you're alone. The study by Nielsen shows that we spend an average of 5.3% of our time emailing, 13% texting, and based on the total mobile time of 4.5 hours a day, we spend about 13 minutes and 35 minutes per day on emailing and texting. So how do you think this is going to affect your skeletal system and the inside of your body? This is what you may look like on the outside. And now, just by looking at this, you tell me which one you are, or which one you think you are at the end of the day. Work is done, everything's done. You're ready to go home. Or you're already home, you're ready to finally close that computer. Which one of these postures are you? Now look to see where your spine is going to be at the rate that you're going. Unfortunately, your skeletal system affects your muscular system, which eventually affects the nerves that are flowing out of your spine. And when they come out and they feed off different organs, poor posture will affect the communication pathways of the brain, the spinal cord, and to the organ, because they have to run through the spinal cord column. So if that tunnel is interrupted or mechanically shifted, it will affect the normal flow of the neurons feeding to the organs that are functioning. So if you tend to be sitting a lot and you have poor posture and any of these problems are affecting you, please refer back to my previous webinars on ergonomics of sitting. You can find that on my website, thinkhealthy.com. Just go to webinars. They're all free. They're available. They're for you to educate you to have a better life. But please consider the fact that these symptoms are real. And this physiological insult is real. This musculoskeletal condition is felt by you, so therefore it is real. Ignoring it does not go under. You can't shove it under the rug. You can't take another pill and say, I'll take care of it tomorrow. This needs to be addressed now. So like Tony Robbins says, when right now is a better time for you to start? When now is a good time to start? So let's start. Okay, so first thing is you're going to take a look at your posture and evaluate yourself. Just march in front of the mirror, move your shoulders around, take off your t-shirt, stay in your shorts, and look at yourself. Look at the person in the mirror. Please don't look at your hair. Don't worry about your body. Don't worry about anything other than check that girl or that guy that's staring back at you. Draw an imaginary line from the front of the body, from your forehead, nose, chin, to your sternum, through your belly button, straight down to the floor. Compare your earlobes. Are they in alignment or one is higher than the other? Look at your shoulders. Is one higher or not? Look at your hands and compare to your body. Is one hand more forward compared to the other? Do you have even curves from right to left on your waistline? Are your feet in the same position, 15 degrees outward, or one is more internally rotated, one is more outward, one is more forward, one is more backward? And if you look at yourself from side, which posture did you think you were? There's a video that I have that you can actually check to see which posture you are. You definitely can find that on my website, thinkhealthy.com. And especially for moms out there, please and and dads, any parent listening to this, please check your child, because the rate of scoliosis and the rate of headaches in children are growing at a rapid, uncomfortable rate. If you're worried about COVID, it's a flu. It can be taken care of with rest, medication, herbs, vitamins, minerals, and you're good to go. Scoliosis is rapidly growing in our children. It's preventable, it's protectable, it's detectable. So please check your children. If you're not sure, contact me. We can do it through telehealth, over the screen. I can walk you through and we can take care of that. But please check either with me or with any chiropractor or healthcare practitioner, chiropractors preferably, because they really look for the underlying cause. Contact your chiropractor, visit them, go get your children checked. It is definitely preventable. Just FYI, treatment for scoliosis, if left undetected and you walk into our office with a phase 2 scoliosis, let me tell you, it's going to cost you somewhere between $6,000 to $150,000 if that is neglected. So save yourself that money, take your family on vacation, and let's live a healthier, happier life for everyone. Musculoskeletal system, you definitely want to check your integrity of your body from right to left, front to back. Your body works in a crisscross pattern. We call it upper body, upper cross, lower cross. Upper cross is from your belly up, lower cross is from your belly down. That's the relationship of your shoulder and your spine and your head, if it's slouched over, compared to your pelvis. If you have a flat back, too much curve, too little curve, your hips are off, your legs are off, your knees are off, your arches are fallen. All these can be checked through just a simple screening in front of the mirror. And because there has been an insult and an interruption between the muscular, the fascia, the tendons, the ligaments, the skeletal system. We need to make sure that, is it a muscular or a skeletal problem, or is it a neurological problem? The difference between a muscular and skeletal can easily be identified by taking an X-ray if your screening is positive. If your screening is negative, wonderful, keep doing what you're doing. If you see something like that, you definitely need to get checked. So make an appointment with us or with your local chiropractor and get yourself checked. What are the things you can proactively do right now to reduce the musculoskeletal conditions that are affecting over 50% of the US population? 1, change the ergonomics of your work. Simple and easy. If you go on YouTube and you put Dr. Romina Gassemi or Romina Gassemi, I have videos in how to use your cell phone to look attractive and sexy, how to sit at your chair, whether you sit in the middle of the chair, forward or at the end, and also how to have a proper ergonomics, all right? Or you can go and find it on my website as well. But rule of thumb, make sure your torso and your thighs and your legs make a 90-degree angle. So remember the 90-90-90 rule. 2, always sit either at the end of your chair where your back is supported with the back support, or really at the edge of your chair so a sneeze will make you fall. This way you activate your core muscles to keep you upright. The worst place to sit is in the middle of your chair. Maintaining a proper position of having your monitor above your eye level. So the middle of your monitor should be almost at the middle of your eye level when you're sitting in a proper position. Now, where do you put your stuff on your workstation, especially if you're working from home? You definitely want to make sure that everything you have is in what we call a sweet zone. There's 3 different zones. There's a usual workspace, there's an occasional workspace, and there's a non-working area. The non-working area, that's where you usually put your, family pictures or items you barely reach, decorations, plants. I would definitely highly recommend to put a humidifier. You could put some aromatherapy on there by adding some eucalyptus oil. The reason I recommend humidifier is because the screen Staring at the computer screen can actually dehydrate your discs because your eyes, because you're not blinking. So if you have a humidifier, it keeps your eyes more moist, therefore it reduces the aging process of your eyes. The usual workspace is exactly where your keyboard should be. And make sure that your body is either the distance from the chair to the desk is as close as possible. Your elbows are always supported. And this gives you a whole area of exactly what you need to do. We call this the sweet zone. The same applies when you want to lift or pick something up. So if you're in the kitchen working, or if you're moving boxes, if you're organizing your house, organizing your office, make sure that you pick items, pick them up, bring them close to your body, rotate, moving your feet to turn to the right or left and placing them in a different place. Do not lift the box with stretched arms, rotate your torso without moving your feet, because that will cause a disc problem. Now, there's another factor besides work, which is sleep, and hopefully you'll enjoy your life somewhere in between. But over 26% of our time is spent sleeping, and the other 7% is trying to fall asleep. So we're really talking about 33% of our time. So let's see how your sleep can affect your musculoskeletal condition. And which one of these are you? Okay, now that you picked your position, let me tell you about a couple of things. One of the things that my patients ask me on a regular basis is, what kind of a pillow do I buy? So before getting lost in the sea of Amazon, let me give you a little guide. There are two types of, sorry, I just lost my screen. Let me see. Okay, what happened? There are two types of pillows. There are pillows that actually offer you, here we go. Sorry, I just lost my screen for a second. I don't know what happened. There are two types of pillows. There are pillows that actually, here we go. There are pillows that actually have an emotional effect where you feel good. We had a little technical difficulty there. Thank you for bearing with me. There are two types of pillows. Pillows that actually feel good. So whether you like feather, whether you like down alternative, whether you like memory foam, latex, hybrid foam, gel type, that's your choice. You buy what makes you happy, what feels good to your touch. Then there's the other type, which is called the functional pillows, right? Those are the ones that offer you the best benefit based on your skeletal system or your condition or your body position, right? And those are the ones, if you have a straight neck, a forward head carriage, or you want to correct those problems while you're sleeping, I suggest pillow number 2, 4, 6, or 3. These 4 are going to give you the most benefit in putting and restoring the normal curve of your spine. But if you have a good curve, you can definitely use pillow number 1 or 5. One of the things that I will highly disencourage is using 2 pillows. Using 2 pillows is almost equivalent of having your head forward by 27 to 45 degrees. So don't put yourself in a state of danger when you don't need to. Use that time efficiently. If you're a side sleeper, definitely pillow number 6 and 4 are going to give you the most benefit. If you're a back sleeper and you want to avoid those wrinkles in your face or wrinkles in between your chest, make sure using number 2 is going to be very helpful, laying on your back. If you're going through menopause, avoid memory foam. They tend to produce more heat. Just a little FYI on the side. Using gel foams or a combination of gel with others is going to give you the best results. Whether you're buying a pillow that's blue, purple, green, that's your choice. It's the shape that matters because that's what alters the biomechanics of your body when you're sleeping. Functionality takes precedence over emotion, but why not have your cake and eat it too? Find a pillow that has that consistency for you as well. If you are concerned about, I don't know if you're still sharing, yeah? Okay. If you're concerned about the mattress, I did a webinar on the type of mattress to choose, and I also have some articles out there. hopefully you will find benefits in them. Okay, somehow, sorry, I have to stop sharing and then go back again. Somehow we're having a little technical difficulty. Okay, let's see if I can get this working again. No, let's try it one more time. Bear with me, I apologize. I'm not very technically savvy these days. Okay, great. Let's do this. I think I figured it out. Here we go. Yes, I did. Great. I think my team will be proud of me. I finally got it. All right, and a nerve pinch solution. If you're suffering from pain in these areas, it could be coming from your neck. So changing your ergonomics, changing your pillow are going to be effective, but there's also a solution for that makes it easy for you. There is, so I put together something that I recommend to my patients. It's called a home relief. It's kind of like a head and neck home relief kit. It helps people to traction your neck. It restores the curve in your neck by having a cervical molding there. There are massage balls inside that actually reduce and get rid of those tight muscles that are right in between your shoulder blades. You really need somebody to dig them. I've given you exercises how to do it against the wall. There's a posture corrector that does not compress your armpit. It actually gives you a full range of motion. It has a silky, soft feeling, so it's very adjustable. Works amazing for a woman who have larger size breasts because it just lifts up your shoulders so you don't have to tighten the bra strap. So you definitely benefit from that. And helps people who have any kind of, some patients have actually felt like their numbness and tingling has gone away. I also offer you a home ergonomic support kit. That kit is something that you could just get. It gives you an adjustable phone stand, massage balls, a wobble cushion for your lumbar spine discs, an adjustable laptop holder. It's basically a combine of everything you would need or everything I would recommend to my patients. The posture product that I specifically put in there is BAX-U because it's the only product in the market that's one, covered by FSA and HSA. Two, does not compress your armpit that may cause more weakness to your arms. And three, it's adjustable and supports your back at the same time. It is backed by scientific studies from University of Michigan, as well as corporate studies that offer, that we actually documented 90% posture correction. If you work with somebody in HR, see if your company can buy it for you because this is a health and wellness solution in one kit, kind of like a dental kit. These are the kits that I put together for my patients to correct problems. First, we have to stop the damaging effect, which is improve posture, change that immediately. Two, relax the muscles. Three, strengthen and offer you exercises that strengthen your neck and back muscles. So it's offering you more of a prevention and protection in the future. That way you're not damaging yourself. My name is Dr. Romina. Follow me on Instagram. I have a whole bunch of health tips over there at Dr. Romina _. If you want to visit me, more than welcome to come see me. I love taking care of people. This is my mission in my life. I hope I can add value to your life by offering you these Wellness Wednesday webinars. So reach out to me through YouTube, Instagram, phone, email, whatever you like, or just stop by and say hi. Thank you so much for attending and look forward to seeing you next week. Share this with the people that you know could benefit from it. Thank you and have a wonderful day.